Hi, everyone. Welcome back to Blessings. As I bring you guests to talk about their stories, I am always interested in the ways that our past experiences and the way that we live our lives in the present contribute to our physical and our mental health. Today, I am honored to have on the show a personal health mentor of mine, Dr. Terry Wahls. Dr. Wahls is a beacon of hope for millions since her viral TED Talk in 2011, Minding Your Mitochondria, with nearly 4 million views, that chronicles her inspirational healing journey. Dr. Wahls is an Institute for Functional Medicine certified practitioner, and she conducts clinical research using functional medicine principles in the setting of multiple sclerosis. In 2018, she was awarded the Institute for Functional Medicine's Linus Pauling Award for her contributions in research, clinical care, and patient advocacy. Dr. Wahls has secondary progressive multiple sclerosis herself, which has confined her in the past to a tilt-recline wheelchair for 4 years. Dr. Wahls restored her health using a diet and lifestyle program that she designed specifically for her brain, and now she proudly pedals her bike to work every day. I've been following her diet protocol for months now, and it has helped to alleviate some neurological symptoms that I had been experiencing over the past year. She is the author of the Wahls Protocol, How I Beat Progressive MS Using Paleo Principles and Functional Medicine, the Wahls Protocol, A Radical New Way to Treat All Chronic Autoimmune Conditions Using Paleo Principles, and the cookbook, The Wahls Protocol, Cooking for Life, The Revolutionary Modern Paleo Plan to Treat All Chronic Autoimmune Conditions. Hear that, all chronic autoimmune conditions. She is the real deal, and she's not afraid to shout it from the rooftops that this approach works. She's also bringing together many other prominent wellness experts and physicians with her Doctor Talks lectures to promote a healing lifestyle for those who are suffering from all measures of disease and dis-ease. She works with passion, authenticity, bravery, and generosity in service to the world. This episode is definitely one to save and share with those you love, and I'm so pleased to welcome Dr. Terry Wahls to the show.
Hey, thank you for having me. And thank you for the work that you do.
Thank you. It's the good work. Dr. Wahls, what kept you going when you were confined to that wheelchair for those 4 long years?
My children and my wife. When I was diagnosed, my son was 8, my daughter was 5. I was still an athlete. We're still being very physically active with the Cub Scouts. And as I became more and more disabled, and really quite profoundly disabled, I'm in a tilt-recline wheelchair, certainly not an athlete. I'm not able to do even the activities of usual daily life. But I have these 2 kids who I know are watching me every day. And so I had to think very deeply, what is the most important thing to me? And how do I parent? How do I be a romantic partner? And I could still show them that, yep, life's not fair, but so what? You get up and do the best you can anyway. And I could think about growing up on the farm. Life wasn't fair. You got blizzards, you got sick, but you had cattle in the barn, pigs in the barn that had to be fed. And I saw my parents get up and take care of the farm every day, and it was just what you did. And if I wanted my kids to grow up and be resilient adults, I could either model giving in to the despair I felt in my heart, or I could model that, yep, life's not fair, but you get up and you do your little workout and you go to work every day and you don't complain.
Yeah, it strikes me that you have an amazing family.
It's because I had an amazing family growing up, and I saw my parents deal with very hard circumstances, and you got up and you did your chores, and I'll tell you, growing up on the farm, if you complained, you got more chores. So you learn very quickly that complaining does not decrease the chores, that you have chores and you get up and you do them. And the other thing that you got to see was the real physical result of doing the chores. So you got to see the barns fill up with hay, the corn crib fill up with corn, the oat bin fill up with oats. You got to see the calves and the little pigs grow up so they could eventually be taken to the sale barn. And you got to see the pastures that we took our milk cows to become lush in the spring, and the milk become lush and creamy and wonderful. And then you got to see that as they switched over to hay during the winter, the milk was not as robust, but there's still milk, and we're still milking the cows twice a day. And the ebb and flow of life on the farm, and the resilience of my parents through all of the various challenges that they experienced taught me a lot. And like every adolescent, I was a crab as an adolescent. I disliked the farm. Thought it wasn't fair. I had to do all of that work, and my friends in town didn't have to do all that work. And they got to be in the pool all summer, and I'm baling hay and making fence and working every day. And when it rained was when we got a break and we got to go fishing. We rarely got to go swimming. We got to go swimming for 2 weeks to get our swimming lessons every summer. And occasionally in the evening, we'd get to go. And then when I went to college, I loved the farm. I missed it. I brought my college friends back to the farm, and they were, very impressed with farm life and the skills that I had. And during medical school and during residency and during undergraduates, I was up at 5 every morning. My friends were all asleep, but I'm up at 5 doing breakfast and doing all of my work, having all of my homework done ahead of time, all of my projects done ahead of time, all of my assignments, paintings, because I was in art, done ahead of time because I was up at 5 doing work. And then I'd do my workout and do my work, and then I'd come back at the end of the day, and it'd be like the second milking. I'd do another round of work, all of my assignments. So I was incredibly productive in undergraduate and medical school because I had the work ethic that I saw my parents have, and I'm sure that their parents had to their parents.
Yeah, I think that's important. I know that's a quality that we don't embody as much these days, and I really admire that. I come from a similar type of family, although not a farming family, a family with a very strong work ethic. I am just seeing a pattern here right away because it feels to me like your ability to do that hard work and immediately see the results that when you feed something, it grows. Do you think
Mhm.
that played into what happened in your mind when you were confined to the wheelchair and you knew that if you fed yourself something right, or if you did something right or something different, you would
Well,
flourish?
what had seen, I'd already had 20 years of worsening electrical face pain for the trigeminal neuralgia. I had seen my father endure basically 30 years of worsening neuropathic pain in his legs before he died. I knew that I had a really terrible future waiting for me of
Wow.
uncontrolled, horrific levels of pain. I knew that before my diagnosis because I'd watched my father. And then I had the face pain, not really well understood. And I'd gone to see a neurologist and I tried a variety of drugs, had drug reactions, couldn't take them, and I realized, okay, it's gonna be the same thing that happened to my father, untreatable worsening pain. And then I'm diagnosed with MS, and my doctor said, "This is not the same problem that your father has," and I'm thinking, "No, you're wrong. It's a variation of the same problem. They're deeply connected. Plus, I already have horrific pain in my face, not in my legs, in my face." So I knew they were connected. I have the MS. It's rapidly progressive. And I'm thinking about my father. They keep telling me it's not connected. I know they're connected. And I know a really horrific future lies ahead of me, but I have my children. I'm thinking about them. They're watching. So they can't see the despair I have in my heart. And I have fewer and fewer options how to teach them. And so I can give them lessons. I can give them chores. I can show them that I get up and I do my work every day. I do my little workout every day to try and keep my function as well as I can. Yeah, and then am I really doing all that I can to take care of myself? And that's when I had this really big aha of you are a physician. You could be reading the basic science yourself because your physicians aren't figuring it out, but there's no reason to say that you can't. And
Because you knew it
so,
was connected. You knew it.
and I'm like, okay, I'll start reading the basic science. So I'm going to
Mhm.
start reading basic science for progressive neurologic diseases. And I went over Parkinson's, Alzheimer's, Huntington's, ALS. Still, it wasn't that much about progressive MS in the animal models. And that's where I thought mitochondria were key. I create this supplement program, super helpful. It slows the decline. And I'm so grateful for that because I've been taught and I accepted that and had seen what happened to my father that the best you could hope for is slowing the decline. There is no reversal of damage to your nerves, to your spinal cord, to your cranial nerves, to your brain. Once you're in the progressive phase, you're in the progressive phase. There is no restoration of function. There is no removal of the pain that my dad achieved or I achieved, and I didn't expect there to be. I knew that all I could do would slow things down. But if I could slow things down, I could keep using my hands so I could feed myself and
Mhm.
I could wipe my own butt. Now, that's really valuable stuff. When
Yes.
walking
Yes.
becomes difficult, oh my God, I want to keep my hands.
Absolutely. Yeah. I'm really interested in what you're saying about your father. And I want to know, first of all, how early did you feel that face pain? How old were you the first time you noticed it?
I was in medical school, and what became apparent was really and of course, there are very stressful rotations where you're getting yelled at a lot by a variety of people. You're not getting sleep, and you're not getting enough exercise, you're not getting enough fresh air, you're not getting sunlight, and that's when it began. And I
Mm.
could tell that when I had not enough sleep, severe stress, I was more likely to have this, pain get triggered, and that nothing stopped it. Narcotics didn't stop it. I would just have to wait for it to run its course for a few days, and I worked very hard to keep my face calm, not react 'cause you have this electrical twinge, and fortunately, during medical school, it was very unpleasant, but I wouldn't call it horrifying. That would come in the first couple of years of my medical practice, so but 6 years later, when I started having the twinges, I'd have this involuntary grimace. My head would pull down either to the right or the left. I couldn't stop that. Yeah, if I concentrated really hard, I could suppress the grunt, and if you could imagine that it's a device that we used on the farm, a cattle prod, where
Mhm.
you have, a jolt of 10,000 volts of electricity, the animal would scream, would leap away from you, that's how you'd get them to go up the chute, into the, truck. I yeah, it's very much you got this jolt of intense electrical pain down your face. It's certainly worse than any times that I've had injury, broken bone, surgery, active labor. At the very worst, when it was the most horrific in 2007, when that pain turns on, it obliterates every other neurologic input. The world becomes white for an instant. I am deaf for an instant. I have this grimace on my face. Yeah, there's and it'll sound like it's just an instant. My knees buckle a little bit, so I never quite fell, but I staggered because it was just for an instant, and then my muscle tone could come back. And so people watching that would be horrified. Oh my God, what's happening? Am I having a stroke?
Mhm.
What's happening? And it was very enormously difficult for my family to be around, watching me go through what they knew was an intensely painful experience. And moving my tongue would trigger the pain. Light would trigger the pain. Sound would trigger the pain. A breeze on my face would trigger the pain. I couldn't swallow. Once it turned really ramped on, I couldn't swallow, so I'm drooling. And if I and my eyes are closed because I don't have any light, and if I try to talk, it comes out like this because that's except moving your tongue triggers the pain. So you could tell that I'm trying to communicate, but all that could come out would be a momentary vocalization followed by that spasm, muscle spasm, grunt. Horrible to endure, horrible to watch. There was a time where I was in so much pain, I agreed to go to the ER, and it was really horrible for. And I feel bad for the medical team because here you have a professor of medicine in obvious pain, and they're trying to talk to me, and I can't communicate because when I tried to vocalize, all I could come out would be they're
Yeah.
trying to examine me and they realize that they're causing intense pain, the light, the sound. It was a very traumatic experience for them, for me,
Mm.
for my spouse. Fortunately, I survived. Eventually, it was one of the most painful experiences I've ever had to endure.
Oh, I'm sorry. That must have been terrifying too, because you think something's going on in your brain. I mean,
Well,
that's
clearly
very
something's going
terrifying.
on, in my brain. It was horrific. We were trying to figure out how to get it turned off, because it was escalating. My family was being traumatized, Then we went to the ER, now we're traumatizing everyone. But fortunately, I survived, and after that, my neurologist and medical team decided that the thing to do was to give me a prescription for steroids, and because I'm a physician, Jack's nurse practitioner, the plan then was if I ever felt the face pain coming on, that I would take oral prednisone before it became horrific in an attempt to keep it manageable so I
Stave
could
it off.
communicate.
Yeah. So I'm very curious about, first of all, when did you meet Jackie? So you were already married when this was going on, right?
I'd started having the difficulty in medical school in 1980. It would take several years. It's about 87 when I finally started seeing neurology. And then I had decided to have children. I was single at the time, got involved with someone that I did not stay with. My daughter was about a year when Jackie and I started seeing each other. We had a commitment ceremony when Zeb was um, 18 months. So that was in 96. Yeah, in 2000, I'm diagnosed with MS.
Mm.
2003, I'm in the short recline wheelchair. And, unfortunately, in 2007, we pieced things together to create this remarkable protocol, really based on all that self experimentation that I had started as soon as I was diagnosed, but really ramped up in 2003. Oh my God, this is terrible. I got to be a whole lot more intense in trying to figure out what I could do to slow things down. And I want to make clear to everyone who's listening I did not expect to recover. I was doing all of this to slow things down because I knew
Mhm.
recovery was not possible. And when I, piece things together, I redesigned my paleo diet. I have this intense supplement list. I've added electrical stimulation of muscles, and I'm walking again. First time in 4 years, walking in the hospital. It's stunning. I still don't know what to make of it because part of what you do when you have a progressive neurologic disorder is you let go of the future. You let go of the future, just like,
Yeah.
okay, I'll just take each day as it unfolds.
Right.
So I knew that my disease you never recover from. I knew that progressive, and this is what I was taught. This is what all of my medical teams had told me. This is what my physical therapist had told me. This is what I accepted was all I could ever hope for was to slow my decline. So I'm walking around. I don't have pain. I have mental clarity. I don't know what it means. I don't know. I really don't know what it means. It wasn't. It wasn't till the day I rode my bike. That Zach's crying. Sebby's crying. Jackie's crying. I'm crying. I still cry. Reliving that moment because that is when I understood that the current understanding of secondary progressive multiple sclerosis is incomplete. And who knows how much recovery might be possible. That was the day that the future came back to me. That was the day that I had hope. That was the day that I'm like, who knows how close to normal I might get. And biked a little bit more every day. And then I really believed that recovery was possible. That no, of course I may not be an athlete again, but who knows how much recovery could be attained.
Right. Right.
Everything changed.
That's beautiful. You are a beacon of hope. I love the idea that you, as a medical doctor, knew that you had to challenge the norm.
Because I had to at least slow down my decline. I had to know that I was doing all that I could because my children were watching.
Yeah.
And I tell my children, and I tell Jackie that they saved my life,
Mm.
that you saved my life because that was the reason I kept reading every day, working every day. Okay, I got to do all that I can.
Was there a sense that you didn't want your children to see you with a neurological condition like you had watched your father and then perhaps be subject to a similar fate?
That was certainly on my mind. Certainly on my mind that I've watched my father endure horrific pain. I'm enduring horrific pain. And I didn't want them to endure that. I didn't, but mostly I was thinking like, Life is not fair. We all have shit. Terrible things happen. We're all gonna lose the people that we love. We're gonna lose our homes, our jobs, our promotions, the romantic partners, potentially even our children. We will lose things that we cherish, and we still have to figure out a way to go on. And we don't mind our successes, the unexpected promotions, the finding the beautiful man, the beautiful woman of your dreams, and they actually want you as their romantic partner. Oh my God, how wonderful! Who could believe I could be so fortunate that I managed to buy or find that wonderful apartment, that home. We love our successes,
Mhm.
but we also have to endure losses. And so I had to think about, okay, I have these beautiful kids. I want them to be able to be resilient because they'll have success, but they're also going to have loss.
Mhm.
And so I was thinking about their future. And I couldn't allow myself to think about the fact that they too might endure what I was enduring. But I wanted them to be able to be resilient because they were going to have other shit
Yeah.
happen that they have
Yeah.
to
It can come
face.
out in
Like,
any way. It can come out as disease, it can come out as something else, and it's very interesting, like, to think about the generational connection for you, but also, I know in your Doctor Talks summits, there was some talk, I think it might have been Dr. Hyman talking about the cumulative toxic load, and this is things like your life experiences, your stress, your environmental toxins, your lifestyle, and also nutrition. And then how all these things can just come together. And like for you, you had the generational experience with your dad, you had the extreme stress of medical school. Was there anything else you think that helped create the perfect storm
oh,
to
yeah.
activate your MS?
One of the things that I don't talk uh, it's only recently that I've begun to talk about this is when I was 8, my mom had my sister, and she died. And my mom had severe postpartum depression. My dad had his own grief, and our family life was in turmoil after that throughout the rest of my childhood because of the enormity of the pain that was unleashed at that time. And now, as an adult, having my kids and having it was interesting when I did my research. In one of the studies, I interviewed everyone that we consented, and what I discovered was everyone had early life stress, severe adverse childhood experiences. And so I did some research as to how common that is. And during that process, I went back and revisited my 8-year-old self
Yeah.
and the enormity of the pain that my and dad endured and my brothers and I endured then for years. And so, yeah, there's lots of things in my history, the genetic vulnerability, early antibiotics, but I
Mhm.
think also we have that severe early life stress that
Yeah.
accelerated the damage. And I didn't understand it growing up, didn't understand as a young adult. And now, as a much older adult, looking back, and I think about my children and being a parent, and the enormity of pain that my two parents had to manage.
Mhm.
So I'm very forgiving of their trauma and very forgiving of the little girl who was confused and in so much pain for so many years. And that level of pain has never been talked about or resolved in my family, never with my parents, never with my brothers. So there's an immense
Mm.
life stress. Now that I talk to my patients about this, I've yet to find someone who's not had enormous early life stress, and sometimes they've gone to see a trauma therapist to help them address those internal traumas. We never talked about my sister's death. My never had the chance to resolve this with my mom and my dad and my brothers and I. Talked about it when I was young, but we've never really talked about it now that we're adults and have more insight. And I remember my mom was with me. I think she'd gone, taken her to a medical appointment, and I asked her about my sister. So my mom's 65. My sister died when I'm 8. Mom's in her early 30s. So 30 years after my sister had died, I asked my mom, and she immediately began sobbing. I try to comfort her, thinking to myself, "What a terrible thing to have done, to have asked her this question in the midst of a medical appointment." So she had to pull herself together, go talk with her medical team, and we never brought that up again. And then my mom died unexpectedly of a ruptured aortic aneurysm a couple weeks after that. I never had the opportunity to talk about this with my mom, other than to know that it still was enormously painful to her. So she
Yeah.
clearly had her own severe trauma from that event.
Yeah. And the importance of the impact of those kinds of wounds back in the family from your parents, even from their parents, and the way those things carry through, that absolutely affected my life, my mother's life, and people who know my story, that my mother had severe childhood trauma. And that although I did not, I believe it has carried through to me and
Mhm.
all other things that have created kind of a perfect storm to contribute to some health issues that I'm having as well. And in the neurological and autoimmune vein. And I think it's something people need to look at. It's something that you don't necessarily want to look at until you have something go wrong. And if we could only talk about it earlier to prevent these things from happening. We think about our toxins in the environment and we could be careful about our nutrition, but we don't think about the mental things, the things that are buried in our families and our pasts.
Yeah, and I understand why when I made the attempt to talk to my mom, it was clearly so traumatic for her. I couldn't bring myself to talk about it again.
Mhm.
That's unfortunate. I think it may have been helpful for her, it may have been helpful for me in finding a way to safely have these conversations and then to help her and ourselves find a trauma therapist, talk therapist who could help us have these conversations and help us heal. And I think part of that is we have to be willing to forgive ourselves. I could think about a variety of circumstances and decisions I made as a young person that I deeply regretted and then hated myself the next decade. And it wasn't until I had my children that I realized, yes, I had to fuck up all that, make all those bad decisions exactly as I did so I could get to have this beautiful little boy and then
Exactly.
this beautiful little girl. And that's when I finally forgave myself for the foolish choices that I made as a very young adult.
But
Like,
most of us
wait,
do that. But you can't beat yourself up for decades for something, especially when you have children, because you might not think that those things are coming through in your parenting, but they are. And
but they will.
self-forgiveness is closely tied to your self-love, your self-worth, your self-esteem, your self-actualization, and all of those things that you need to be emulating as a parent so that your kids can be self-actualized as they grow, you
Absolutely,
know?
and a talk therapist can help us think through and establish these new patterns of thinking for ourselves. Sometimes free writing
Yep.
in conjunction with talk therapy to guide new understanding and new insights. Super helpful. As one of the things that my talk therapist had me do, and then I continued, and super, super helpful.
Mhm.
I now think this is a very helpful part of the healing process,
Absolutely.
that self-forgiveness
Yeah. Oh, it's huge. No
is
matter
so
what,
important.
we are all doing the best that we can in that moment under those circumstances. And even if you have majorly messed up, it is your greatest teacher, that moment. And it is your opportunity to see how you can learn from it. And then not just learn. I have a theory that based on Bloom's taxonomy, that it's not enough to just understand and to analyze our lessons and our places where we are, instead of, I say, opportunities for growth instead of mistakes, because I think that's what they are. But then you have to transmute it. You have to change it. You have to create something
Mhm.
new out of it. That's where things will get better for you. That's where you'll make those
Yeah,
changes.
absolutely. We don't learn from our success. We learn from our mistake, our losses. Okay, that was not such a good decision, and I'm gonna make a different decision next time.
Yep.
Because when I make a good decision and everything goes well, I didn't learn anything. What the learning happened when I didn't make a good decision and Huh, I'm not doing that again.
And that's where you make the big leaps. That's where
That's
you
where you
make
make the big leaps.
yeah, it's so
And
great.
and in my life, I've made big mistakes and many times, and I have big setbacks. Then I have to think very deeply, okay, what do I do next? Where's the learning? Where's the opportunity? And what has happened is it's caused my career to make professional changes, which are very invigorating. It causes me to leave a stale place, professional place, or other involvement, and that I make a forward leap that I would not have made. And so I have this conversation now with my colleagues, with my family, and some of my closest professional allies. When things went wrong, they sat me down and said, "Terry, so what? You're gonna be fine. I've gone through terrible things too. There's a gift here.
Yep.
You're gonna be fine." I and it now sometimes it takes a while to figure out
Yep.
what the gift is because it's usually not obvious.
Yeah.
It's usually not the one that you've wanted or were working on, okay? But it is always, thus far in my life, given me extraordinary opportunities and growth.
Mhm.
And never were they the things that I wanted to be doing at the time.
I know you've talked about how when you first started to put forth your theories about nutrition and making these types of lifestyle changes, it wasn't really well accepted,
Oh, not
and
at
I mean,
all. I was vilified.
you were taking a chance.
I was vilified. The MS neurologic they condemned me, banned me. The university called me and said, and the VA chief of staff called me and said, "What's going on? People are complaining. We hear you're banned. What are you doing?" Now, fortunately, I brought with me my handful of scientific papers and explained what I was doing. And I just picked a few because I knew you'll only be able to talk about just a couple. And my chief of staff at the VA said, but you have to follow the standard of care. And this isn't
Mhm.
the standard of care. And so I had mentally prepared for that, and so I said, "Well, of course, you send out an email to all of the faculty that we have to follow the standard of care. We can't follow some of the latest scientific studies. Of course, I will follow that." And then I sat back and smiled and waited, and it felt like an hour, but I'm sure it was not that long. And then my chief of staff said, "Okay, if anyone gets hurt, if it's an adverse event, you'll go through
Mm.
peer review and you'll lose your license." And I'm like, "I'll go through peer review?" And that's fine. I said, "Terry, you're gonna lose your license, so we're gonna send you to the complementary alternative medicine clinic. You gotta learn how to talk about this in a way that is not offending people, because what you're doing is gonna somebody files a complaint, you'll lose your license. The board of medicine can come through, and if they see that you're not practicing the standard of care, you could still lose your license. So you have to talk about this differently." And so it kept saying, "Lose your license." So I was
Yeah,
like, "Oh my
like,
god,
very threatening.
this is" I'm worried about it because yeah.
Mhm.
So we're gonna get you to the complementary alternative medicine clinic. You gotta learn how to do this. I went to the complementary alternative medicine clinic. Dr. Nicole Knisely sat me down and said, "Terry, you're gonna lose your license. You gotta learn how to do this correctly." Man, now there are a lot of people telling me that I could get into big trouble. So I listened very deeply, and then I was much more careful to make clear that I am not treating your disease. I
Mhm.
am helping your cells do the chemistry of life more correctly. And then I'm just watching for sight, make sure that we're not over medicating you. Now, that's a message that people were okay with, that we're just helping you improve your nutrition and your self care routine. And then I'm watching you very carefully to make sure you're okay. That's a message that I was careful to document in the chart. I was very careful to say, this is not an FDA approved treatment. This is just supporting better nutrition and self care.
Mhm.
And then I was very careful and all, and I worked out with my attorney and the university the language I should put on my disclaimers in my books, in my lectures, say clearly that I'm not treating you, I'm not your medical doctor, but we're just trying to help you run the chemistry of life a little more effectively. And we didn't have complaints anymore. And my chief of staff actually became a huge supporter. My chief of medicine became a huge supporter. And people came in to complain and say, "She's just telling us to do what we should all be doing. And if anyone gets hurt, she'll go through peer review." And then my chief of medicine, who's a rheumatologist who takes care of autoimmune people, who knows how remarkable my recovery is. He wants me to get a case report written, and I say, "On me?" I said, "Yeah, on you. Work with your treating medical team, get this written up." And then he had us write some case series. And then at the time that I was writing the case report and the case series, goes, "Write out what you did in a protocol, because you're going to do a single arm clinical trial, see if other people can do what you did. Can they actually
Yeah.
do all of this complicated self care that you're doing? And we'll see what happens." And I said, "I don't know how to do that. I'll get you the mentors, Dr. Wahls. This is your job."
So they wanted you to fit into their mold.
Actually, it was wonderful. He became the dean of the College of Medicine, and he really wanted this study to happen.
Yeah.
He helped facilitate making sure I had the right mentors, that I could address the concerns to make sure that we were doing this safely. And we got that first study done. It had stunning success. People actually could change their diet, could do the meditation, could do the exercise, could do this painful process, electrostimulation of muscles, could
Mhm.
take all those supplements. So it was a lot for people who were severely disabled, who were between cane and walker, and how disabled they were. So it's stunning that they could do all that stuff. And then it was stunning that the severe fatigue remarkably improved for the group, that the quality of life remarkably improved, and that half of these folks had significant improvement in walking function. And we've gone back, we've done some reanalysis. We'll be publishing on that data. That's some more exciting stuff. Now,
Okay.
it so we had these remarkable findings. It took us 2 years to find a journal that was willing
Mm.
to publish that, because part of the problem was, because we did so many things, supplements, diet,
Mhm.
meditation, exercise, electrical stimulation of muscles, it was hard to find a reviewer who was willing to review it, because they'd say, "I know about electrical stimulation, but I don't know anything about all this other stuff."
Mm.
Or, "I know about diet, but I don't know about this other stuff." There was a bit of a challenge to help the journal find reviewers who would be willing to review it. So we finally got that first paper published. And it was very helpful. My now dean of the College of Medicine kept saying, "Terry, you keep at it, you keep at it." So we got that first one published. Then it was much easier to get the second one published. And now we have about 30 papers published with the various studies that I've done. I was looking at our citations. We've been cited by other investigators 1,700 plus times.
That's amazing.
Yeah, and here at the university, and so over time, the VA, Iowa City VA hospital, pulled me out of primary care, and I thought, I was not surprised, but I was quite surprised. I said, "What we want to do, Terry, is we want you to have your own clinic." And then I said, "No, unless you can get documentation that the chief of the hospital and the chief of staff support this." And 2 weeks later, I was back meeting, and there was the memo that they supported this. And so we launched. It took still about 9 months to get everything lined up, but then we launched the therapy lifestyle clinic. And I went to primary care, specialty medicine. I said, "Give me your sickest, most difficult people with pain that you can't help. And I want them to have some sort of autoimmune issue, and let's see what I can do." And then we're not giving them drugs. We're just doing diet and lifestyle. And so I went to the pain clinic. I went to specialty medicine clinics. And we got a handful, not many, just a handful, but we're very successful. Then we got more. And I kept having to reimagine my clinic and how we did it, because I didn't want people to wait a long time. So we went from group appointments eventually to classes, so we could let people come.
Teach more people.
Yeah, and then VA central office wanted to come. I thought, "Oh dear God, I'm in trouble now." So they came and they were super impressed. So they took the concepts that I was using and used them in the whole life clinic, and incorporated many of the concepts we're using. And that clinic has concept has been expanded to VA and became national. And then I had also started teaching these concepts to other clinicians, and I was running a conference where people from all over the country and world would come, literally hundreds of people. And we'd gotten funding from the MS Society to do the study comparing the swank and the Wahls diet. And now I had a decision to make. okay, I can't do all of this. Something's going to have to give. And should it be teaching the public? Should it be the research at the university? That wasn't going to give. Should it be the VA? And I decided that, okay, I love the VA, I love the vets, but there's a lot of cumbersome, annoying things at the VA that, like any large bureaucracy, can get troublesome. I said it was time for me to move on from the VA, so I retired from the VA so I could spend more time on my research and more time developing my teaching programs for the public and for other clinicians. And so that's what we've been doing. And then this last year, I had this big decision because people have been telling me for years to have a MS summit. Looked like a lot of work. And finally, some of my close friends sat me down and said, Terry, you really should do this because you could reach so many more thousands of people. And so I said, okay, I'll do that. Now, fortunately, I didn't quite understand just how much work it really was. We made the leap, and I developed a close relationship with the Dr. Talks team.
Mhm.
I enjoyed them. I've enjoyed working with Brett a lot. And I believe we had 44,000 people sign up. That's really pretty cool. And
Very
I s
good. And the concepts are not just applicable to MS. They're also very, you could extrapolate out to
mm,
a lot of other things, really anything, I think.
yeah, I think, anything, it's particularly useful for people who have pain,
Hmm.
particularly useful for people who have fatigue, who have anxiety, depression,
Hmm. Hmm.
and, brain fog issues.
Hmm.
That and of course, that people with autoimmune issues who have those symptoms,
Right.
this and that's tens of millions, if not hundreds of millions of
Oh, yeah.
people, this would
Yeah.
be very applicable for. And
You have some new research coming up as well. You're doing some new research.
yeah, yeah, yeah. We have this really wonderful study comparing olive oil-based ketogenic diet, the Paleo Elimination diet, which is basically the Wahls elimination diet, and to usual care. We enroll people, get all the walking, vision, thinking assessments, hand function, MRIs at baseline. Then we randomize you to one of these three diets, bring you back in 3 months for a quick recheck, make sure everything's okay, then bring you back 24 months after the first, and repeat all the assessments, including the MRI. What we'll be able to see is, so what's the effect of diet on, walking, hand, vision, thinking function, and what's the effect on brain volume?
Mhm.
Because we know that, yes, we have these great drugs that do a wonderful job of turning off relapses and new enhancing lesions. But these drugs don't do much for anxiety, depression, cognitive decline, and we also know that brain volume for people who have a autoimmune disease hitting our brain with pain or those symptoms, our brains shrink at about 1% or more per year. Healthy aging is 0.3 so 0.3% or less per year. If you have healthy aging, you're likely to have mental clarity and you won't be frail, you'll be fine into your 90s. If you have a rapidly shrinking brain, you're going to be in assisted living or nursing home with severe cognitive decline and frailty. In my clinical practice, we see that the anxiety, depression, cognitive decline disappear really very quickly. That people can see things are improving usually within 3 months, almost always within 6 months. So one of my hypotheses, and I'm very excited about to test this one, is if we teach people how to eat, wow, can we get them to healthy rates of brain aging? And what percent of the population that we have in those 3 diets will achieve healthy aging? Because I'm predicting that the 2 intervention diets will get to healthy aging, and it's also quite possible the control diet, which is usual diet, and we give people a monthly tip sheet on how to improve their diets with deep basically more non-starchy vegetables and less junk, and we give them tip sheets on how to do that. Then I bet the 3rd group, the usual diet, was gonna improve their diet too.
Mhm.
Because they agreed to be in a, nutrition study because they wanna improve their diet.
Yeah.
So, I may not be able to show a difference between the 3 groups, and I'm okay with that. because I added this MRI component, because we know that people with MS, our brains shrink too fast. That's why we have job loss rates that are so high. That's why we have early nursing home rates that are so high. That's why we have assisted living rates that are so high. And the DMTs don't appear to be able to stop that. They can stop the enhancing lesions, but they don't stop the other trouble. It will be huge. That paper
Huge.
will be huge because it's the first one that will say, "You know what? But you can do, folks." I'm super excited. And the other thing that I do, and part of this is yes, I do research studies. I realize that we know we have a terrible disease. We don't really want to be in a control. I have to give the control something, so they're getting support every month. And I'm okay with the control arm getting better too. You have to have yeah, you wanna have a way to design the study so that you still have interesting results at the end, even
Mhm.
if your control arm, gets better.
Well,
So,
that sounds amazing. One of the things, obviously, that I've learned from you is the importance of nutrition. You don't really think about it as harming you until you have a problem, and then you wake up.
yes. And before I go on, I wanna tell everyone, so if you have relapsing remitting MS between the ages of 18 and 70, I want you in my study. So please
Right.
go to terrywalls.com/MS study. You'll learn more about the study. Hit the yellow bar, take the survey now, enter your data so that we can at least get you into our database for future studies. And if you're eligible for the current study, then we'll reach out to you and tell you what the next steps might be.
I'll put all of that information in the show notes so people will have easy access to it.
Okay,
Yeah,
great.
it's so important. And I know we're coming up to time here. So I just want to ask you in closing, Dr. Walls, because we're on the Blessings podcast, what are the biggest lessons that you've learned over the course of your life?
Knowing what you could do with better health, and think deeply about that. Why do you want to do this work to have your health improve? I had great clarity because I loved my wife. I loved my children. I wanted them to have greater resilience. So that was my purpose. I now know to ask my patients, what is your purpose? A good way to get to this is if the house was on fire a little bit, so smoke's coming out. Is there something or someone that you'd love so deeply you'd run over broken glass barefoot to go save
Mhm,
without thinking about it
mhm.
because that mattered so much? And nearly always people can say, my children, my grandchildren, my spouse. And then if the answer is nothing, I know I have to send them to a talk therapist so we can
Oh,
help them
wow.
find something.
Yeah.
And then if they have something, then the conversation goes, we want you to be there more fully for that person. We can begin to identify what is the small next step that could help you either improve your nutrition, reduce your stress, improve your sleep, improve your exercise. In which domain would you like to work?
Mhm.
So we want to be sure that it matters to them because we figured out a reason to get them fired up. Then we want to figure out a domain that they're okay with working at. And though I love it when they choose nutrition, I've learned to be okay with it if they say, "You know what? I wanna choose sleep, or I wanna choose stress management, or I wanna choose exercise." And we start in that domain because people
And
have
then
to
you
do
can move
things
on.
they have to do things they wanna be doing.
Yeah.
That's
Not
what
an
do
easy
stuff.
thing. Yeah.
It's not easy.
No, and it's a lifestyle change. It's not a quick fix. It is a long term. If it's taken you, you may have symptoms when you're in your 20s or 30s, but those things have been brewing for a long time. And it takes a long time to get back on track. Like I've learned that. You're not going to be able to go back to eating your donut every morning for breakfast. I don't think
Correct.
ever, maybe every now and then. But what do you think about that?
For me, if I have gluten, dairy, or eggs, my face paint turns on. And so could you imagine intentionally shooting 10,000 volts into your face?
No, and why would you? It's the same. I have
You
the same reactions with
you know?
my symptoms. I get neuropathy, I get paresthesia, like tingling in my body, and if I eat gluten or dairy, I get those things. And why would I want to do that to myself?
It's super helpful to teach people. We start with small, achievable next steps of things you want to do. It's not things that I want them to do. It's things that they've decided that they want to do.
I
And
see.
then we build from them. And yeah, again, it was my veterans that taught me this. My veterans that taught me the most important thing is to figure out what is your why,
Yeah.
or go to talk therapy if you don't have a why, because everybody needs a why. And then once you have your why, then we have to help them figure out, okay, in these domains, these environmental factors that we have control over, small achievable next steps, but pick one domain that you'd like to work on. And it needs to be something the vet wants to work on. Now, it's not what Walls wants them to work on. It's what the
Yeah.
vet wants to work on.
Yeah.
Yeah.
Yeah. It
And
has to be
now that I get
personally
that,
meaningful.
I'm very successful. If you think you're gonna tell people what to do, you'll be miserable. They'll be miserable. You won't have patience.
And there are a lot of doctors who want you to just blindly follow what they say. And you have to be your own advocate these days. You have to take agency over your health.
Professor Bill Bean, when I was in medical school, taught me a wonderful internal medicine doc. He was getting very old. I wondered, could he really be teaching us? But he taught me at the end of every medical encounter, you'd say, "What did you learn? What are you going to do? What did you learn?" If they didn't learn anything, you were not an effective physician. I had to learn how to speak more plainly with better metaphors. And then when I asked the question, "What are you going to do?" And people said, often, "Hell, not up doing that, doc. That's too hard, too expensive, too whatever." I'm like, "Okay." That was very helpful because now I knew what people if they're gonna really do what I want them to do or not. And then he taught the next question, which was so insightful. "Okay, so what could you do?"
Mm.
What that meant was when I finally got into private practice, I learned how to talk plainly to my, patients, learned that a lot of things that I'd been taught to ask people to do, they couldn't do for a wide variety of reasons. And when I moved on to what could you do, I got people to do things that they wanted to do, and they would come back and they'd be successful, and my patients were getting better. My patients liked me. I liked them, and it was a way more fun way to practice than most of my colleagues who were not aware of that their patients couldn't do what was being asked and didn't know how to negotiate more effectively with them
Mhm.
to ask for things that they could do.
Make it an interaction rather than a transaction.
Correct. So I was a very different kind of conventional doc that I had a lot more fun with. And then, of course, then another layer of education came on that I did not want. Yeah, and, that was when I got the MS and had to recover that. So that
Mm,
took me about 7 years before I learned the lesson I needed to learn.
wow.
And so had I never gotten MS, I'd still be an athlete. Maybe I'd be doing triathlons. I'd probably be in position leadership. And that would have been a great life. But you know what? I think this life is probably even better than that one. So,
Yeah.
yes, I'm not doing triathlons yet. Who knows? Maybe I will
Yet.
eventually.
Yet.
And but now I've had an impact on millions of lives, and I'm teaching thousands of practitioners every year. I would not have had that impact had I had never gotten MS and continued to get to be an athlete and gone down that other route, which would have been a great life, I'm sure. But
Mm,
I love my life.
yeah. Would you consider MS to be a blessing for you?
Oh my god, it's such a blessing. And now this is the other thing that my trigeminal neuralgia, the immense pain that I have, and I saw my father have 30 years of horrific pain. I had endured 27 years of progressively more horrific pain. And this is the worst pain that is known to humanity. Yet, this is such a blessing because I now know I have it's like a continuous glucose monitor on my brain. I know the level of inflammation on my brain moment to moment. I know how happy my microglia are, that is my immune cells in my brain, moment to moment. I can walk into my neurology office and say, tell them what they're going to find in the MRI. because I have my continuous microglia sensor that is exquisitely sensitive moment to moment. And so I've been teaching my neurologists and the neuro departments here at Iowa that pain is your friend,
Yeah.
that pain is your continuous inflammation monitor for anyone who has an autoimmune disease and pain. That we can teach these patients how to monitor for their triggers of increased pain and their factors for decreased pain,
Yeah.
and they can learn how to better manage their disease.
And you get to that point by getting yourself back to a state of relative homeostasis with through your nutrition and your lifestyle practices. And that's
And and
critical.
it and it takes a while, and it
It takes
takes
a while.
a very helpful guide to walk with you on this journey.
Get Dr. Walls's books.
Yeah, I get my books, they're, a wonderful guide, and then for people who and we have many people who are just completely transformed with the
Yeah.
books. We do have people who wanna come work through our programs because 'cause they'd like to be able to ask me questions every week, and that can be super helpful. We have, seen people in private practice for people who really want to have that an even deeper relationship. But again, my book has 400,000 copies sold between the book and all the translations and the cookbook.
Mhm.
So those are a lot of lives that have been transformed. Plus
Absolutely.
plus the 4,000,000 that have watched the TED Talk.
The TED Talk. Ugh, it's just profound. The effect you've had on humanity is profound. And I think you're just like an angel on earth, really. I do.
And maybe it was my sister
Oh,
coming back and whispering in my ear and whispering in the ear of my chief of staff, who called me and said, "Terry, people are complaining. What the hell are you doing?" And maybe it was my sister whispering in my chief of staff when he called me to the office to say, "We're gonna send you to the traumatic brain injury clinic come January," described the job, and it was a job that I couldn't do. And I thought this was gonna be what was gonna force me into medical retirement. Turned out to be that was a huge gift because then I was gonna see those vets who, until I showed up, who said were being told, like, "Yeah, there's nothing we can do. You'll recover somewhat or not." And I was the first one who said, "Oh, man, there's a lot you can do, and let's be
yeah.
sure that you're doing it all."
There sure is. There's always something you can do. I just believe in healing. I believe in self healing. I believe in the body's power to heal.
And I will acknowledge that there are conditions that we haven't figured out. Things like ALS, Huntington's disease, those are conditions that we haven't figured out. We know that people who have those will progressively decline, become more debilitated, and eventually die from their illness. And it's true, we'll all eventually die, even me. But by gosh, in that journey, I'm gonna do all that I can to have the most meaningful life, the greatest contributions. And there's always a lot that we can do. Even for our ALS patients, even for our Huntington's patients, we teach them how to have the best function that's possible given their circumstances, the most meaningful life that is possible given their circumstances. That's really quite transformative. And our ALS patients, I'm sure, do much better using our protocols than eating the standard American diet. Our Huntington's patients do much better following our protocols than the standard American diet. And yeah, I tell the families that, yep, I can't stop the disease, but we can slow it down and help you have a more meaningful life in this journey.
Yeah, that's beautiful. What was your sister's name?
Mary Ellen.
Mary Ellen.
And that name was to honor her grandparents, her grandmother on my dad's side and her grandmother on my mom's side. She had red hair, beautiful red hair. It's really a thick mane of red hair, beautiful child.
Mm,
I remember her. And of course, I'm only 8, so I don't fully understand the enormity of what was about to unfold. I was thinking that, okay, life would just go back to the way it was. And
mhm.
of course, that was not the case.
Yeah. I really am touched that you shared that story with us, and it really helps us to understand you and to understand ourselves more when we hear those stories and when we're not afraid to tell them because they're so meaningful.
Yeah,
And I just want to thank you from the bottom of my heart for being here today, Dr. Walls. You're amazing.
thank you.